The mainstay of therapy would be fluids.
Have you seen dogs get pancreatitis from, say, getting in the trash and eating a bunch of stuff that's in there? Is it more serious in smaller dogs? Is the survival rate different for the size of dog? Is the prognosis dependent on how soon you start treatment?
Yeah, I mean, I think that's a huge difference.
Can it just a general change in diet? How likely is that to cause an inflammation of the pancreas? Can you treat pancreatitis at home?
You can. I would strongly advise that you don't.
What are some of the treatment options at that point? What would you recommend?
Yeah, so even before the diagnosis or the presumptive diagnosis has been made, the blood test, and some clinics have like SNAP tests where they won't give you a value for that CPL, that specific lipase enzyme, but they'll kind of just tell you like yay or nay, if you will, on this SNAP test. What I would recommend for treatment, first thing, the mainstay of therapy would be fluids. So IV fluids. Get an IV catheter into the dog, and put an e-collar around him, put him in a cage, get the fluid rate, and start that ASAP. And you can also get some pain relief going in the line. Maybe an opioid like fentanyl, CRI, in with the fluids, because it's an incredibly painful disease. And just kind of pump the fluids in, and monitor. And this generally should be done so that a patient can be monitored throughout the day, overnight. I currently don't work at an overnight facility, but usually it's important to kind of monitor for development or worsening of symptoms like vomiting or diarrhea, and kind of address those with different medications if necessary. But what I would say would be fluids is the big category of treatment. Analgesics, so something for pain, and then talking about like antiemetics, something to kind of combat the nausea and try to prevent recurrence of vomiting from happening, which also may be helpful with stimulating the appetite. There's a lot of, it's one of those things where you ask one vet or two vets, you'll get three opinions kind of in terms of what you do in terms of nutrition. We didn't really talk about causes of pancreatitis, and probably because no one really
we'll
knows.
Get there.
We'll get there. Okay. So it's one of those things where one of the potential factors that can be associated with pancreatitis is ingestion of a high-fat meal, shortly before symptoms may start. The day before or earlier that day, owner gave some cheese pizza or something like that, or who knows what. That can definitely precipitate these episodes. And so in terms of getting, a patient may present with not eating for a day or two. And so do you continue to withhold the food or not? And I'll be honest, I've seen different patients with pancreatitis, and I do different things for them depending on, how they look to me. And if a dog who comes in with acute pancreatitis and is really depressed, down, doesn't even, if you may be floating a little bit of Roacaine, really yummy, digestible, low-fat food in front of his or her face, he won't smell it or anything, then it's just I'm not even gonna offer it. But if the dog comes in a little bit more bright and alert, but has a lot of the other symptoms and may be willing to eat, I'm going to offer her a little bit of low-fat food, periodically through the day. But so that's kind of one of the things, being conscientious of what you feed her, and then especially once a patient has been hopefully successfully treated, giving the owner discharge instructions and making sure that they know that, foods that are high in fat, maybe the dog food that they're on, or if they're getting a bunch of treats, something that something off the dinner table that's really delicious, but probably not good for their health, those would probably be contraindicated. And making sure that, we kind of keep a check of that, because they definitely could recur in the future.
Have you seen dogs get pancreatitis from, say, getting in the trash and eating a bunch of stuff that's in there?
Absolutely. That's like one of the, I would say like that is I can't assign a percentage, but that's a frequent flyer in terms of why dogs may get pancreatitis, for sure.
Now, do you see is there a difference in breeds of dogs coming in, little dogs versus big dogs with pancreatitis, and does that change your course of treatment? A Chihuahua versus a Lab comes in.
Yeah, so I guess in terms of breed predisposition, there really isn't one, but I would say that I've anecdotally and in a lot of literature, miniature schnauzers are the breed that get this the most often, and I've definitely seen that quite frequently. But as far as treatment of a Great Dane versus a Chihuahua with this, I mean, I think the difference in treatment would be, fluid rate, obviously, and how much of the dose of the specific medication. But I think it's more so.
Is it more serious in smaller dogs? Let's put it that way. Do they have a greater chance of becoming dehydrated or than a larger dog does, or is the survival rate different for the size of dog? We always used to see the little dogs come in with pancreatitis because the little dogs would always eat the whatever the owner would give them, something off the table, give some bacon or some whatever, and next thing you know, the dog's coming in puking its guts out. So
I'm not sure, honestly. I don't know the answer to that question as far as difference between large versus small breeds. But I don't know. But I would venture to guess that that is probably I really don't know. I can look into that, but I don't know about the survival rates. But it's one of those things where you get the diagnosis and you may find the specific number and where it relates to normal, where that canine pancreatic lipase is normally for a dog, and for dogs who it's way askew, and that may correlate with the clinical impression, and they may be down and out and super lethargic, vomiting all night, really painful when you pet their belly, but not even they can't even move sometimes. And so the prognosis there, whether it's a big dog or a small dog, is going to be guarded. Whereas, if a dog's, maybe it's 400 or 450 and maybe not quite as high, as a dog with really severe acute pancreatitis, whether large or small, I would probably give a better prognosis. I have had a couple, in vet school, there were a couple of patients with really acute pancreatitis who passed away. But generally speaking, it can be managed quite well, with pretty aggressive fluid therapy for 24 or 48 hours, I would say.
Is the prognosis dependent on how soon you start treatment? If people have been waiting for a couple days and then they come in.
I think that's a huge difference too. The longer you wait, the potentially more of the pancreas that could be, digested and inflamed, and it can become hemorrhagic and bleeding and, lead to peritonitis. And just the longer you wait, the worse prognosis for sure.
Is there a difference between chronic versus acute? Is there a chronic and acute pancreatitis?
Yeah, I mean, for sure, certain dogs who, some owners don't assign enough weight to some of what they're seeing. And so they may, first time patient or something, and they come to me and they said, oh yeah, my dog has been vomiting, he vomited, 4 times this week, but that's normal or something. And it's really not. It's, and so you kind of have to convey that in a kind tone, but, forceful, because obviously, you're advocating not for them, but for their dog, and trying to get them to understand potential severity of stuff. And, talking about, diet and definitely acute pancreatitis, if not treated, or if treated successfully, but the owners don't really do, the requisite diet changes, it can definitely come back and last for longer than a couple weeks and be considered chronic, and may not or no longer respond to the typical therapy that we would do. And then you may potentially start with steroids, which have their own potential side effects. I wouldn't jump to that in kind of an acute case, but that's kind of one of the differences that I would consider for, acute versus chronic treatment.
Are the causes different between the two? Or is it all pretty much this? It just depends on how long you wait.
Yeah,
whether it's acute or chronic.
Yeah, no one really knows. I'll probably start off with that. What we're taught in vet school, it's because of a fatty meal, and that's more of an acute thing. But if a dog is constantly getting, really high fat foods, or, treats off the table, getting to the garbage frequently, that could lead to elevated triglycerides in the bloodstream and just this kind of basal level that promotes this pancreatitis on a kind of a chronic sense. But, so that's kind of the one thing, the nutritional side of things. Then you have potential for drug-induced pancreatitis. So actually from corticosteroids, that could actually cause pancreatitis. Some anti-epileptic drugs can lead to, some gastrointestinal problems, including pancreatitis. And then there's the potential for, and I've not seen this particularly in my time as a clinician, but there's been described blunt force trauma, hit by a car case, or a dog that was dropped or something, and just really bad trauma to the abdomen that may cause pancreatitis. So those are kind of the causes that I'm aware of.
Wow, I don't know about that.
But no one. But then again, oh, sorry, what were you saying?
No, go ahead.
It's just one of those things where a client may come in with no history of any of these things, and they may have been feeding the same diet to their dog for years, and no change in exercise level, or dog didn't get into the trash, no new medication or anything, and yet they're presenting for all these symptoms. And so the doctor should definitely discuss that that's a possibility and try to rule it out. And it's possible the dog may come back positive for pancreatitis, and treatment would be warranted. So it's just one of those things where it could be idiopathic, and you don't really know how to assign a cause, but you can put your finger on it. You can do the test that shows that it's there, and then you can go ahead treating it. But that's kind of a scary thing, because you don't know what actually caused it. I had a cat bite who bit me, and it hurt like hell, and then I got cellulitis and my hands full up. I know what happened. Imagine if I woke up in the middle of the night or the morning and without having the bite, I would be, even more freaked out.
Right.
So that's kind of one of the tricky things when it comes to, situations like this, especially, they can't, the dogs can't say anything. And if there isn't any history that the owner can share with, even the most diligent owners, they may not know of anything that could have precipitated it, even if you let them know all these potential causes. It's just one of those things where you just got to treat it if you find it.
A high fat meal or a high fat diet can cause can lead to pancreatitis. Can just a general change in diet, how likely is that to cause an inflammation of the pancreas? If you don't go to like a high fat, you just switch their food.
Yeah, I mean, I think that that's possible as well. Typically, and this is why we recommend to owners, gradual transition. And I have a lot of, I had a lot of puppies who came in today, and their owners are just trying all sorts of different diets in really short time frames. I had, this one 9-week-old dog that was like on from duck and then beef bone broth, and then some other Stella and Chewy something or other, and diamond chicken. And I'm like, let's pump the brakes here. First of all, this is my first time meeting your dog, and I don't mean to, step in here, but your dog is coming in for diarrhea. I wonder, of the 1,000,001 causes, and we had our show on diarrhea a few weeks back, but there's so many different causes, it's possible the dog could have like, I didn't smell it today.
Right.
And the dog was in good health and, feeling great, running around and curious and everything. But I'm like, I just wonder, let's try to isolate some variables here and, do away with all these different diets, and then maybe come to a closer ideal of what could be best to feed your dog. So she agreed to kind of, only do the one diet that he had been previously eating and doing well on. But she had changed it because maybe he wasn't eating as much or not finishing the bowl or something. And, some puppies are like that. So to get back to the question, how likely is a diet change to cause it? I don't know how likely, but I think it definitely could be a possible cause.
If a dog has had pancreatitis, how likely is the dog to get it again down the road?
I don't know the answer to that question. I'm sure there's 100 different variables that are involved, but I think the biggest one would be compliance. And I think that the dog would be far less likely to get it if an owner is going to stay on top of diet management, not be feeding stuff off the counter, keeping the trash locked in the cabinet or whatever, and maybe switching to like Purina EN or like Royal Canin gastrointestinal low-fat diet, some therapeutic diet or something that is a little bit more indicated than a cheeseburger.
I think we could all go for that too. So, hey, can you treat pancreatitis I know you should. Can you treat pancreatitis at home?
Can you repeat the question? The audio is going a little in and out. I didn't actually hear.
That's fine. Can you treat pancreatitis at home?
You can. I would strongly advise that you don't. Yeah, I saw that question. I'm like, if there's any takeaway that we've had from these sessions is that there are a lot of potentially good home remedies and, less life-threatening diagnoses that can be, a vet visit can be put off, or, kind of like with telehealth, kind of ascertain based on symptoms, what might be a good approach to kind of treat at home. This is one that, if a dog, because the owner's not going to know if the dog has pancreatitis or not. I had an owner who came in who didn't come into the clinic. We're all just talking over the phone with COVID these days. She brought her dog came to my clinic, presented to me in the exam room today. And I had a number of, sorry, it's a cat. I had a cat owner. I had a number of like GI cases today. This cat came in, 9-year-old cat, and it had been vomiting for 2 days. And I asked if the cat had a history of like eating things that he shouldn't. She said that she has like been chewing on like plastic wrappers and bags and stuff like that. And so I do worry about foreign body obstruction as a possibility. And she said, and so like I told her, of the things we can do, blood work, antiemetic medication, x-rays, just to be on the safe side, things that, she would need. And the owner was like, and then, you constantly get more information in the phone call that's different from what, you had been told earlier that the technician had communicated to you. So I get more and more information. Apparently there's the other cat at home, the sibling who's also been showing these signs. So, what's the likelihood of that? But when I told the owner, doing x-rays would be recommended, she said, oh, well, I ruled out a foreign body, or that, something that the owner was telling me that she ruled it out because the other cat was also showing symptoms similar. And I was just in my head, I'm like, oh, good on you for ruling that out. Like, I can't even rule it out. I would need, imaging. I don't know what your cat has right now. And pancreatitis was on my differential list. So, we're running blood work and we'll probably get some answers tomorrow. But in the short term, she kind of opted for the more conservative approach, and, that's, the owner's prerogative, of course. But, I did what I was entrusted by her owner to do for her. And at the end of the day, obviously, if she does come back positive, we will definitely be more keen on seeing her back, or suggest that she go to another hospital for IV fluids. But that was it was just funny to hear like the owner saying like, oh, I ruled this out, when at home you can only really do so much diagnostically and therapeutically. So pancreatitis, anytime, if your dog is having vomiting, lethargy, inappetence, pain, if you're rubbing the belly and they may be wincing, I wouldn't play around with that at all, and I would definitely go seek veterinary attention.
Yeah, and who would have thought that both cats could eat the same thing and have foreign bodies? I'm glad we ruled that out.
I'm glad we ruled it out too.
I mean, they're both vomiting. No way they could have both eaten plastic bags and had plastic bags inside of them. Hey, if you like this video, don't forget to like and subscribe to the channel and share it with all your animal-loving friends. My name is Mike the Voice Monkey, and we will see you this week with Dr. Max on Ask Our Vet.